Morning, everyone. My name is Aisha. I'm from the London Borough of Hounslow, and I work in the transport planning team. I'm a transport projects officer, and I'm working with Chris from the Public Health Department for the first time, so it's quite an interesting project. And we're focusing on parents whose child is starting school for the first time, and in England, that's in nursery. So they start school at 3 years old for half a day. Sorry, I'm a bit out of breath. And they also start full-time school and reception at 4 years old. So we're targeting both those age groups. So just a bit of background about Hounslow. We're situated in the far west of London, so Greater London. And we're a population of about 600,000 people. And it's quite a diverse borough. We've got over 120 different languages spoken. So after English, it's Punjabi, Polish, and then Urdu. High young population, over 50% are younger than 35. So quite a lot of people, young families. We've got Heathrow Airport, which doesn't make the air pollution great. So, but good connections into London, very good bus and train transport links. And we do have lots of green spaces, lots of parks, which make promoting active travel a really good possibility. So moving on to schools. We've worked with schools for quite a few years to promote sustainable travel, and we had really good reductions in car use. But because of the expanding population, it's started to creep up again. So between 2012 and 2014, we've had a 5% increase in car use again. So that's why this project's come at quite a good time. And in Hounslow, there's quite a high proportion of children who are overweight and obese. So we do 2 measurements, one in reception when they're 4 years old, when they first enter school, and one in year 6 when they leave school, primary school at 11, and that's increasing year on year. And low levels of physical activity amongst children and adults, and high car usage in some schools. And most schools have a problem with traffic outside the school gates, which make it unsafe, and which makes parents not want to walk and cycle. So it's kind of a vicious circle that continues. And as I mentioned, poor air quality mainly because of the Heathrow Airport and the high car use. So I'll hand you over to Chris to talk about the pilot.
Thanks. So the reason we wanted to use the Switch campaign to try and address some of the issues that Aisha talked about is we think it will really work and fit in with some of the issues that we've got in Hounslow. So the key things, the principles of Switch that we talked about earlier, the life change moment, personalised travel advice and technology, we've decided to put them in Hounslow in a particular way. So the life change moment is children and their parents who are starting school for the first time. We think this is really important because we know that travel habits can be formed quite quickly, and once they're formed, they're very sticky and very hard to shift. So we've really identified those first couple of weeks that a child is going to their school for the first time as the point where we need to try and intervene and support those habits. We're looking at the personalised travel advice because we want to make it easy for people to make walking or cycling their choice. So it's around providing them with support to find safe walking routes and also to find popular walking routes, see what other people are doing. And then use of technology, as Veronica said, it's all about making it fun, making it enjoyable, and making active travel the byproduct rather than the primary outcome of doing the intervention. So we've taken these kind of 3 principles and applied them within Hounslow, and the overall project in Hounslow, we've got an ambitious target of trying to shift 750 people from using their car for short journeys to school to walking or cycling. We're looking at having a noticeable impact in the number of children who walk to school, which is a 5 percentage point increase, which we'll measure through some surveys with the children. And we also want to try and measure if we've increased awareness of the health benefits of active travel. And also we want to make sure that we've got an intention to continue after the Switch campaign. So we plan for the campaign to start, it's going to start this autumn, but because we're looking to work with 36 schools, a kind of a target population of about 3,000 people who will be starting school, we wanted to test some different approaches to see what would work before we went ahead and did the full Switch campaign. So back in autumn last year, we looked at trialling 2 elements, the personalised travel planning and the Beat the Street. So with the personalised travel planning, we worked with 5 schools. What we wanted to do here was really test all the different stages of this project. So from the coordinated recruitment of people into the campaign, when we started, we didn't have, or still don't have the data of every individual who's going to start school in September or October. So we need to go out and proactively recruit that. So we identified induction events at the schools, which is where the parents go along to find out what school uniform they need to bring, how they get school lunches, and we brought into that project, into that process, a point where we could actually recruit them into the Switch project. So we have consultants who attend all of the induction events, and they recruit the people at that point. We then looked at working out what was the best way to deliver personal travel planning. So we tried over the phone, doing home visits, and also group sessions at the school. And the idea here is to sort of test what takes the most resource, which ones work the best, and which ones fit in with the Switch campaign going forward. And as I'm sure you'll appreciate, there were pros and cons to each approach. We found that the telephone campaign, where we were calling people up and giving them personal travel advice, worked well in terms of our resources, and we could reach a large number of people. However, with a lot of schools where we have a very diverse population, and language not always being English as the first language, we struggled to engage with high numbers of people through the telephone surveys, whereas the group sessions were very good at engaging big groups of people in schools, using that sort of peer pressure as well at the same time. But they came at a much higher cost, and there are also practicalities of trying to fit them in. So we did PTP in 5 schools. We also had 5 schools who didn't get any intervention, who were our control group. We did PTP in July, August, September, through that period before they started school, and then we measured the walking rates in the schools, the control schools, and the other schools in September and October, and we were able to see that the schools that had personal travel planning had increased their walking more than the schools who were in the control group. With Beat the Street, we again wanted to test how we would do this locally, where we would put the Beat the Street beat boxes, as Veronica showed, and how we'd work with schools and engage with them. So we tested that in 2 schools. We had 22 readers, and we had a really high engagement with schools. It worked really well and worked to deliver some of the outcomes for the schools. So we had the teachers getting involved. We had high engagement at both schools and a good competition between the 2 local schools. There's some maps over by the side which show the area that we worked in, the 2 schools and the different readers. And let's see what other results we've got. I'm just going to jump ahead to this survey here, which Veronica mentioned earlier. This was the data we just got today. And this shows a survey that was done of participants of Beat the Street in the 2 schools we did it in. And it shows the number of days that people chose walking as their main mode of transport. So if you look for the first bar, the darker blue, is before Beat the Street at the baseline. And then we've got after Beat the Street, and then we've got 4 months later. So just looking at 0 days, so the number of people, the percentage of people who said, we don't walk on any day, at the start was 12%, after was 11%, and then 4 months later it's dropped down to 4%, which is really, really good. And you can see essentially the 0, 1 and 2 days a week, the more inactive, people who aren't walking that much, has reduced over time. And if you look at the 3, 4, 5 and 6, over the period, the trend is to actually increase. And we think that's really encouraging. And something that's managed to kind of nice that it's managed to stick after the initial intervention. During the actual intervention, we had some good feedback that we had 74% of people said that Beat the Street helped them to walk more. We had one of the interesting things was the main reported benefit was around that sense of community. And we found that more than in some of the other Beat the Street surveys that have been done. That sense of working together as a group, being involved in something, was really important and a real motivator for our groups. So that's what we want to try and build into our next intervention. So I'm just going to hand over to Aisha to talk about our future plans now for the full rollout of Switch.
Okay, so something that we've already done is scoping with the schools, because we found when we done our pilot, every school runs their induction day differently. So some would do a formal evening event, some would do a drop-in session during the day, so we had to tailor how we interacted with parents, because the more informal sessions we couldn't really get that good engagement, whereas the formal sessions and endorsement by the head teacher was really a key to getting the parents to sign up. So we've kind of done that, so we kind of know what approach we're going to take with each school. We're going to launch Switch officially with schools in June, so we'll have a half-day conference with teachers being invited to come. There'll be some workshop sessions about personal travel planning. There'll be Intelligent Health will be explaining the Beat the Street concept, so just to really get them on board and know what's coming in plenty of time. We're going to involve pupils in doing walking routes to schools, so they'll know different ways that they travel or certain things to highlight on the way to school, so we really want to get schools to have buy-in to the maps. And we're going to have assemblies to launch Beat the Street, and we'll try and get pupils again to be involved in that. And so the rough timeline, we also have head teacher meetings every 2 or 3 months, so all the head teachers meet up to discuss things, and we've got on the agenda to talk to them about that because it's key to have them on board and to explain that they don't actually have to do that much. So it sounds like quite a big project, but we pretty much do everything for them. And then June, a week after that, we'll do the teacher conference. Because we've found that teachers like to get out of school and will pay their supply cover and have a nice lunch and network. It's a really good opportunity. And during July and September, we'll do the induction events and get the names to do the personal travel planning. October, we'll do the baseline survey. So before or during the first week that the parents actually doing the journey, we'll find out how they're traveling. October, we'll do the personal travel planning aimed at just the car users. And then we'll start the Beat the Street game, and then we'll start doing all our after surveys. And that's it, really. We hope it goes well. And that's it. Yeah.